I'm Justin Gallagher, Associate Publisher of the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. This week, the National Academy of Medicine said the next phase of healthcare reform must cover how patients are diagnosed. Too often doctors make the wrong call, or it takes too long to reach a decision. In a 300-page report, the Academy called for changing the way doctors are trained, for creating a workplace culture that encourages feedback instead of punishment, and for getting patients involved so that they are encouraged to share information. Other recommendations include changing the legal environment, which today discourages sharing information about errors or near misses. The report said the movement toward payment reform, which will reward doctors for spending more time with patients, is a step in the right direction. The slowdown in healthcare spending isn't reaching the average consumer. That's what the 17th annual Kaiser Family Foundation Employer Health Benefits Survey found this week. Results showed that deductibles have gone up 6 times faster than wages since 2010, while premiums are growing modestly. The effect is greater at smaller firms where workers face an average deductible of $1,836 compared with an average of $1,105 paid by workers at large firms. Said Kaiser Family Foundation President and CEO Drew Altman, with deductibles rising so much faster than premiums and wages, it's no surprise that consumers have not felt the slowdown in health spending. One of the top stories this week at AJMC comes from contributor Andrea Jacobs, who writes about the growth of nurse practitioners and physician assistants in primary care practices. These healthcare professionals can help busy practices overcome the shortage of primary care doctors, but Jacobs warns that it's important to take steps in hiring and supervision to avoid pitfalls, including lawsuits. Among the steps she recommends, take time to write complete job description, conduct a thorough background check, and correct patients if they refer to the nurse practitioner as a doctor. To read Jacobs' essay, visit ajmc.com. Dr. Mitzi Wasik, the Director of Pharmacy Medicare Programs at Aetna, also spoke to AJMC recently about the importance of teamwork in a practice and how it contributes to accountability under new pay-for-performance models.
Stakeholder accountability is also something that has changed, where previously it was the physician and now it's the teams. So look at ACOs and how are those teams being built and structured, and who within the provider's office is taking responsibility for these initiatives. One provider office can have 10 different health insurers come to them with their P4P models, and physicians are trying to treat the patient. So they need that person in-house to be able to take these programs and unfold them. And so how to make them work. You need that expert. You need that office manager that has all of the quality improvement experience, or a pharmacist. Some of the most successful groups we've worked with have pharmacists embedded in them, or nurses that have been working in quality for years and they understand it and they get it. So it's just part of the normal day-to-day activities and worked within the physician's practice.
Finally, the current issue of the American Journal of Managed Care features an important new study from Dr. Yusuf Zafar and his team at Duke Cancer Center. The team found that about half of cancer patients want to talk to their oncologist about the cost of their care, but only 19% do so. Patients were more likely to want a discussion about costs if they were in financial distress, and their willingness to discuss treatment costs increased over the duration of their care. About a third of patients said they wanted the best possible care no matter the price, which researchers said suggests some may fear that bringing up cost could lead to a lower quality of care. But when patients did raise cost concerns, the study found that adjustments did not affect their care. Dr. Zavar will be one of the speakers at our upcoming conference, Patient-Centered Oncology Care, which will take place November 19th to the 20th in Baltimore, Maryland. For information and to register, visit ajmc.com. For the Managed Markets News Network, I'm Justin Gallagher. Thanks for joining us.